Straightsmile Solutions, straightsmilesolutions.com. Let's ask the sensei. I'm really not a sensei, but I feel like I'm a wise one today. Let's give some wisdom about the treatment timing for class 3 correction, e.g. the only one that really works is bringing the maxilla forward on retrographic maxilla to stimulate the maxillary growth and to fix a class 3 that way. It's not possible to fix a mandibular elevated jaw growth. I know they make chin cups and stuff, but the research is junk. It doesn't really work. You can't stop nature, let's put it that way. But we can stimulate an upper jaw to grow. So see all my videos if you want to know more about class 3 treatment in a growing child. Remember, you can't do it. You can't change bones in an adult. If you're done growing, you're done growing. So without jaw surgery. You can change teeth, but you can't change the bones, which are the scaffolding or the foundation for the teeth, right? So if the foundation isn't there, you can't move the teeth without a foundation. So you got to have the foundation it's on. So there's only so much you can do within the limitations of where the foundation is. Hopefully that makes sense. Okay, so that's your maxillary jaw growth. Now keep in mind, a maxilla has sutures, right? You've got your palatine suture, the one that runs along the midline, and you've got your other sutures in the back. I think there's like a zygommaxillary suture. I don't remember. This was long time ago. I took head and neck anatomy in 2001. But there are definitely sutures. So if you know anything about distraction osteogenesis, you can look that up if you want to. That is a term that is used with orthopedic surgeons. I didn't say orthodontist, I said orthopedic. That means like your regular like bone surgeons that do legs and arms, stuff like that in the hospital. Broken legs, broken arms. If you've ever seen anyone that has like a major growth disorder or they have like a limb issue or one's shorter than the other, they do something called distraction osteogenesis. But they also do it in your face. So that is where they put some pins in and they stimulate the link. Usually if there's no suture, they're gonna actually have to make a break in the bone, then slowly turn these screws in order to move the two units apart. But you can't like make it like super far apart, right? Because the bone's not just gonna fill in. It has to be like millimeters, like fractions of millimeters, a little bit at a time. So essentially, that is what an RPE is, or a expander, a palatal expander, assuming the patient is still growing. And there's something called a MARPE or an MSC where you do it in adults, where they actually will throw implants in and they will literally break the suture. Always risks. I'm not helping you with those cases. But in kids, the suture is not fused. So it's just easy. You just turn the screw and boop, it just pops open and the bone fills in. Not a problem. No blood, no pain. Assuming you're not doing it too fast, not a problem. Little gap between your teeth. Works great, right? And it also, since the palate is the floor of the nose, it also gives you a better airway. So you need to get a little more volume at the floor of the nose. Helps people breathe. It's just a win-win-win. So that's why the people who have really, really tiny maxillas that just didn't grow right due to habits or poor diet when they were little, if they don't get their ortho done before they finish growing, they're going to have a very compromised outcome. And a lot of these people are struggling right now, and they're trying to get surgeries and stuff when they get older, or do all these different types of funky things that are out there, which I won't make an opinion on, but if you want to know, they are in my YouTube channel. You can look up adult expansion. This is just my opinion as a provider, not disparaging, because I've been sued before, not disparaging any companies specifically. I'm just giving you my blanket statement. Some of the stuff works, some of the stuff doesn't. Be careful. I'm not helping you with it. In adults at least. Okay, boom, let's move on. But there are people who will, so I can refer you to people. I do know people who can help you with those cases. It just won't be me. I choose not to. Okay, so in comparison, that is your face mask therapy. There's also tandem. I have lots of content in my YouTube channel. You can look up class 3 growing or class 3 tandem, class 3 face mask. I have a lot of content on face masks because I've done lots of face masks in my life. That's me with a face mask on my head. No, I did not wear one. Okay. Let's move on. Let's talk about class 2 changes. That was class 3 changes. Now we're talking about class 2 changes. Oh, back to the class 3. Sorry. Class 3. I've had luck. It fixes really nicely. As long as the child is still growing or within a year or two of when they finish growing and they wear the damn thing, and assuming you've loosened the sutures with an RPE, of course, it's always good to loosen them first. I always get better outcomes if I do. Assuming you picked the right elastics, the patient actually wore them 14 to 16 hours a day, not just nighttime, 14 to 16. bare minimum 14 and you had the right elastics, the orientation of the elastics was right, the way that you set the head and the chin was right, etc. It works. That's all I gotta say, it works. Okay, so if you're not seeing a change of at least 0.25 to 0.5 millimeters during every time they come in from, I'd say, every 5 to 6 weeks, they're lying, they are not wearing it. Or you did something wrong. You didn't loosen the sutures, you didn't pick the right elastics, you didn't orient the elastics right, or you didn't set this up right. So definitely get a consultant if you don't know what you're doing. Okay, move on. They work. So anyone that says it doesn't work, I will let you know, is a liar, liar, pants on fire. Okay, next, let's talk about MA. Invisalign with MA has changed over the years. So all my previous videos shows the wings, this is the blocks, okay? Haven't seen a block case yet. Supposedly they're rolling it out slowly. I have never had a doctor that's had a block case. We haven't had a block case, but supposedly they're coming and they're marketing it. So I'm not quite sure if I love the blocks, just because the photos I've seen shows that they're one on top of another and not like ramps like they are in a twin block. And I feel like the bite is open in the front, and I'm worried about mouth breathing, and I'm worried about that. I'm not saying it's not going to grow a jaw, but I'm afraid it's going to do vertical things too. And already MA does crazy vertical stuff. So don't know. Again, this is just what I've seen. This is just my concern. Okay. So MA, I have not seen as much success. It doesn't matter, MA, twin block, any type of class 2 growth modification. I have not, first of all, you got to wear this thing 24/7, or at least 23/7. It's not no nighttime only, sorry for my English, or anything like that. 23 to 24 hours a day. You will see the same results, the 0.25 millimeters per month, if the child is still growing or is still in the puberty growth spurt. And if they actually wear it properly, it does work, okay? So I want to let you know that. Of course, you're also aligning teeth at the same time, which is nice, right? You can do the same thing with a face mask. You just, at this moment, there's no way to hook a face mask onto an Invisalign or an aligner, not that I know of. Maybe someone's Jimmy rigged something, but they haven't come up with something. I'm sure they will in time. So it's nice. So you have to do it first, which is kind of a pain in the butt. And there's no way to hook it onto like an IPE. That would be amazing if you could hook it on. All the things I want. And everything I always ask for in Invisalign always ends up showing up. I'm not saying that they're taking my ideas, because they're probably the same ideas every orthodontist has, but I'm just saying it would be nice if we could do that. But moving on, yes, MA does work as long as the patient is still growing. I'm not sure if it works a year or two after. Elastics work, but they tip teeth, right? They don't really grow a jaw if you look at the Ceph afterwards. Remember, with MA, there's always a little bit of shiftiness, and it's hard to tell. Sometimes people think they overcorrected, and then they end up relapsing because it's just muscle memory. So it is sometimes difficult to know when to stop. And I've seen some cases that have overgrown, so you just sometimes you gotta like stop, pause, deprogram, settle, check again, which is why you never ever want to do an MA case with a limited amount of refinements. These suckers take a while, okay? But they're amazing and they do work, so I'm a huge fan. So that is my thoughts about when to do it. And back to like how early. I've seen these work as young as 6, 7. I've seen these work as young as 6, 7. I mean, we were using these in patients who, the same thing as twin block, right? So I've done twin blocks in 5, 6, 7. I mean, as long as they have their 6-year-old molars in, and they work great. So matter of fact, some people think you have to do it, once they're like in their peak growth spurt, 12, 13, risky, very risky. Because a lot of times you get to peak growth spurt age and they're not going to wear it at school, which is why I would maybe it works a little faster, but 9 times out of 10, the patient's not being compliant at 12, 13, 14. And boys, that might be 15, 16. Oh, there's no way that they will not wear it. I'm going to tell you flat out, they lie. So it's very rare that you found a boy that's going to wear it. And I could just tell by looking at the boy if they're going to wear it. So there's just ways I know a lot about teenage boys. I have to have teenage boy. I've had 3 brothers. Teenage boys are very different than teenage girls in terms of orthodontics. So I would prefer to do it earlier. All right. Thanks so much. Hopefully that helped.